This functional anatomy video is focusing on topics of the muscular system. Now, our spec labels this bit as E4 antagonistic muscle pairs, which is a bit misleading because it implies there's a pair of things, two things to learn, but actually there are 4 muscle actions that we need to understand. You could replace the word actions by roles, so 4 roles that muscles take on, and that would be probably easy to understand, but I'm going to call it actions for 2 reasons. So the 4 muscle actions are when muscles play the role of the agonist or the antagonist, and those together combined actually are the antagonistic muscle pairs, agonist and the antagonist. Muscles and muscle groups generally work in pairs. But a muscle might play the role or have the action of being the synergist or a fixator role. So there's 4 types of muscle action or muscle role that we need to know about. And again, this topic might come up in a short answer question, but it definitely is a significant part of your question 12, where we analyse movements at 3 joints, and you will have to state what the agonist and the antagonist are for that action, and what are synergists and fixators as well. Just a bit of revision really of some of the anatomical terms used. So we've got a typical muscle, or biceps brachii in this example. This is the belly of the muscle, and with the tendons of the biceps brachii attach near the point of connection to the axial skeleton, so the shoulder joint, and also down over the elbow joint. The biceps brachii works over the elbow joint primarily. The tendons attaching at the end, which is proximal, the proximal end, which means it's nearer this point of attachment, is called the origin, and the muscle inserts down at the radius down here, that would be called the insertion. So the name of the tendon, or the tendon that is by the attachment to the axial skeleton, is the origin. That's the proximal end. The distal tendon, the one that's further away from that point of connection, is called the insertion. Generally speaking, what happens to make movement happens, generally speaking, this muscle contracts, more often than not shortens, this tendon is pulling on the bone and movement occurs. So when biceps brachii contracts normally, this insertion pulls on the radius and flexion occurs at the elbow joint. So what are the 4 muscle actions? So the simplest 2 to learn to start off with are the agonist and antagonist. So for a simple movement at the knee joint, this is our femur, our tibia and fibula. We've got, in order to create flexion at the knee, our hamstrings would contract concentrically. So at rest, nothing is happening. When they contract concentrically, the muscle shortens, the tendons get closer to each other, the insertion is pulling on the fibula, and the knee flexes. The angle at this joint gets smaller. If I wanted to do knee extension, so I want to straighten my legs, so it's from a slightly flexed position here, my quadricep is at rest. The insertion of the quadricep is actually at this tibial tuberosity here. So the patellar tendon extends over the knee joint, attaches down on the tibia. So when the quadriceps contract concentrically, they shorten, the insertion gets closer to the origin, and that pulls on the ulnar bone, and our leg extends, our knee extends and gets straight. Another couple of examples, easy one, bicep flexion, biceps brachii contracts concentrically, pulls on the insertion, which is on the radius, and the angle at this joint is reduced and flexion occurs. But during this time, triceps brachii has to also kind of do something passively. So whilst biceps brachii is contracting as the agonist, triceps brachii needs to relax and lengthen to allow that movement to happen, because if it was contracting at the same time, we'd have pulling in from both sides and conflict. So if biceps brachii contracts and shortens, to enable it to shorten and move the forearm, triceps brachii must relax and lengthen. And that muscle, triceps brachii, is playing the role of the antagonist muscle. We want to control this movement, so it lengthens to control the movement, to oppose the movement, not in a bad negative way as in oppose, but to control the movement. The reverse movement then, elbow extension. If we want to have extension at the elbow and straighten the arm, triceps brachii would play the role of the agonist, and it would contract concentrically to pull on the ulna. But in order for that movement to be able to happen or be possible to happen, biceps brachii needs to be in a state of relaxation. It needs to lengthen to control the movement, to allow the movement, to oppose the movement. And those phrases are all really useful phrases. So typically speaking, in a normal movement, one muscle in a pair of muscles, because muscles work in pairs, one is the agonist, one is the antagonist. Or in the opposing movement, in this case, they swap roles. Triceps becomes the agonist and biceps brachii becomes the antagonist muscle. Here are some other examples. So in order for us to raise ourselves up onto tiptoes to plantar flex at the at the ankle, gastrocnemius, this calf muscle, is the agonist. However, if we wanted to pull our toes up to dorsiflex, anterior tibialis, now it's not shown on the diagram, but it's on the front of the shin. Anterior means to the front of, tibialis, the shin bone. That would be the muscle that would be contracting to pull up. So depending on the movement that's occurring, one of the muscles in the pair will be the agonist muscle, the muscle that does the work, that does the contraction to make the movement happen. The opposite muscle tends to be the antagonist that relaxes and lengthens to allow the movement. Here's another example at the hip joint. If we wanted to abduct at the hip, again, it's not shown on this muscle, but we've got two gluteal muscles. There are 3 in total, but there are 2 that are a little bit more on the side. So we've got gluteus medius and minimus. They would contract to pull the femur out away from the body's midline, abduction. The partner muscle, the adductor group in this example, would need to be relaxed and lengthened to allow that abduction movement to happen. However, if we wanted to pull the leg towards the midline, i.e. hip adduction, the adductors, adductor longus brevis and magnus, they become the agonist, and gluteus medius and minimus are the antagonist muscles that must relax and lengthen. At the shoulder, a shoulder abduction, middle deltoid. Remember, there are 3 parts to the deltoid muscle group. Middle deltoid pulls the humerus up away from the body's midline. The muscle group that needs to relax during that and lengthen would be latissimus dorsi. However, if we want to pull the arm down towards the body, latissimus dorsi is the agonist, middle deltoid or medial deltoid becomes the antagonist. Last one, for radial ulnar pronation and supination, that pair of movements. So if we turn our forearm so that our palm is facing up, that's supination. Easily, the muscles that do this are our supinators. Similarly, the muscles that pronate the radial ulnar joint at the forearm, we've got our pronator muscles, and a specific one that seems to be named as pronator teres. So hopefully that's a lot of examples of antagonistic pairs. The agonist that does the movement by contraction, and the antagonist, the partner muscle, that opposes the agonist, that has to lengthen and relax to allow a movement to happen. However, as I said, we need to know the 4 muscle actions, or the 4 roles that muscles may take on. And the additional 2 are called the synergist and the fixator roles. So in doing our bicep curl over here, going from being extended to flexed, biceps brachii is the agonist, the main muscle that contracts. Sometimes it's called the prime mover, but that muscle contracts to cause the movement, the main muscle that creates the movement. We know already that triceps brachii would need to be the antagonistic muscle partner that opposes that movement, that controls that movement, that must relax and lengthen to allow that movement to happen. However, A synergist takes on the role of assisting the agonist. It helps the agonist. So if you remember synergists assist, that's a really nice way of remembering. We've got a muscle that also goes over the elbow joint, but it's much smaller than biceps brachii. So brachioradialis, during flexion, is a synergist. It plays the role of a synergist. It helps a bit. It's not big enough on its own to do the whole flexion movement. Biceps brachii is the bigger muscle, but brachioradialis helps and plays the role as the synergist. What we also don't want then is shoulder movement. We want the movement to be isolated during a during a bicep curl. We want the movement to be isolated to the elbow joint. So we want to kind of contain our shoulder. And deltoids, the deltoid muscles, might be contracting isometrically, not creating any movement, in fact, trying to keep the shoulder joint stable. Actually, another muscle that would pull the arm, pull the humerus towards the side of the body to keep it still would be latissimus dorsi. So that muscle is kind of on your back and on your side, and it attaches on the humerus. So that would also act as a fixator muscle, isolating the shoulder to the body so that only the elbow is moving when biceps brachii contracts. So those are the 4 roles of muscles that you need to learn. Agonists create the movement by contraction. Antagonists relax and lengthen to control or oppose the agonist. They work with it to allow the movement to happen. Synergists assist the agonist, and fixators stabilize other joints. So they stabilize other joints. And actually, your core muscles often work as fixators. They stabilize your trunk. So again, you don't bend forwards and backwards, and you move, and you have unwanted trunk movement. So in summary, here's the text, here's the information that summarizes the role of the agonist or the prime mover, the role of the antagonist, the role of the synergist, and the role of the fixators. The phrases here are really good ones to learn. And obviously you'll be applying these actions, these roles, to possibly a short answer question, definitely within the 3 joint analysis in question 12. One final cautionary point. So muscles work in pairs. However, some movements, some skills, some exercises, not always, but especially those that have up-down movements. So this is a tricep press. You straighten your arm to move the dumbbell up, and then you lower with control. Here we go from the preparatory position to the cup shape here by squeezing your glutes, squeezing your erector spinae here, a little bit of hamstring contraction. You hold that position, and then you lower with control. This one is also an upward downward movement. So pectoralis major is contracting to pull the shoulder forward, probably triceps as well to extend the arm. But then we want to lower these dumbbells with control. Gravity is trying to, in all of those examples, push out of control those objects, whether it's your body or the weights, push it down. We want to lower with control. And unfortunately, what you've got to remember is this. In up-down movements, the agonist will be the same muscle. So, for example, in this tricep press, to straighten the arm upward, triceps brachii is the agonist muscle. However, to lower it down with control, triceps brachii is also the agonist. It doesn't swap over, doesn't become biceps brachii. Even though you're bending your arm, you're flexing your arm, and we would probably associate that with biceps, we don't need muscles to pull our arm bent. We need muscles to control the bending of our arm. So in this example, erector spinae and the gluteals, they would contract concentrically on the up phase while this athlete is creating the cup shape. However, we need to lower our arms and our legs with control rather than just face plant. They would contract eccentrically as the agonist in the downward phase. So they contract concentrically in the upward phase and eccentrically in the downward phase. In both phases, they remain the agonist. This would be true of pec major and of your triceps in the upward phase of this chest press. They contract concentrically going upwards as the agonist, but they contract eccentrically as the agonist in the downward phase. It's something to be careful of. This exercise over here, I'll just give this as a last example, is a sort of an odd one because it's not up down, but because it's elasticated, because the resistance is trying to pull the athlete's arms backwards, the athlete's pec major and probably anterior deltoid would contract for horizontal flexion concentrically, but we don't want their arms to fling back with that elasticity, with that band. So they would contract eccentrically to control the backward phase movement. So this is not an up-down, it's an odd one. Most of our sporting actions aren't up-down in this way, aren't with elastic resistance. So, for example, that same sort of arm movement, horizontal flexion for a forearm, for a forehand, pec major would contract concentrically. For a backhand, probably the rhomboids and trapezius would contract concentrically. So these are normal pairs, normal contractions. It's just the up-downs mainly that you need to be aware of, whereby the downward phase has the same agonist as the upward phase. Kind of consider that a rule for up-down actions, like press-ups, like squats, like tricep dips.